Hi everyone, my name is Rubina and I am here on behalf of Centennial College to tell you why you should select the Medical Lab Technician program here. A lot of people have confusions with what Medical Lab Technician program is and what a Medical Lab Technician does, and I will be here to answer all those questions for you today. Starting with my favorite question, what do you know about the Medical Lab Technician program? A lot of people actually can't answer that well because most of the answers I get are, oh, they collect blood. Oh, they may do some sampling, pre-analysis, or diagnosis inside the lab. But they don't know what they do exactly. So let's delve into the basics. What is medical lab technology? Medical lab technology is actually comprised of 5 different disciplines, which go from clinical chemistry, hematology, histotechnology, microbiology, and transfusion science. Another interesting aspect is that there's a subcategory, which is coagulation, and that goes under hematology, which means the study of blood. Now, what the Centennial College does is that it builds on the students' hands-on skill and their knowledge and helps them apply that into, collecting samples, into performing procedures on different tissue specimens and other bodily fluids like urine. Medical lab technicians are actually only get taught to specialize or collect urine samples, but we do analysis on the other bodily fluids as well. Now, moving on to the program duration. The program itself at Centennial is actually a 1-year-long program. It's a certification course, so you can go to it right after high school. It consists of 3 semesters. The first 2 are hands-on and theory. The last semester is where you get clinical experience, so you actually have an opportunity to go to different hospitals and do your placement there. Now, one interesting question I always get asked, and I mentioned this before, is the role of a medical lab technician. What do we do? Yes, we collect blood, but that's not all. We also collect some bodily fluids like urine, and we also perform ECGs, which a lot of people don't know. We also are taught to prepare specimens and solutions which we need for pre-analysis. We also handle medical laboratory equipment. We are in charge of quality assurance and control of the equipment, so we have to make sure that the equipment is working well for other lab personnel to use. We also set up and sanitize laboratories, so we clean the laboratories once everyone is done using it. And lastly, we record everything that we analyze, and we also make reports on if anything goes wrong in the lab or if nothing goes wrong in the lab, so we have to make a report on what goes on in the lab. And that's the main role of a medical lab technician. Anything that's diagnosing the patient is done by a medical lab technologist. Now, why should you be a medical lab technician? I mean, it's not diagnosing patients, so why? Well, it's actually the most important thing in the medical field. Medical lab technicians have a very important role. Not only do they have face-to-face interaction with patients, they are also the soul of the whole medical diagnosis program. We are the people that actually do the pre-analysis, so the medical lab technologist can take the sample and analyze it for diagnosis. Other than that, obviously there are a lot of jobs available now. Medical lab technicians are highly in demand, especially at the end of 2018 when a lot of medical lab technicians will be retiring. The patient interaction and satisfaction is a very important part too. Then there's time and experience. Centennial College offers students 1 year of practice and then they can go into the field. So that's a very important thing. Now, what are the advantages of a medical lab technician? Well, you get quick entrance into the medical profession, like I mentioned before. There's also a career advancement opportunity where you get to advance your career into becoming a medical lab technologist. So you don't just stop at a technician job. Then the last thing is that there's an excellent environment for those who want to practice in healthcare. So if you are interested in working with a physician, if you're interested in working at the hospital, you can do the technician job and you get free access to it or fast access to it. Now, where there are advantages, there are obviously disadvantages, and those include that this is a very stressful job. It's very strenuous. You have to be up on your feet all the time. There's obviously a risk of disease due to exposure to hazardous fluids. There's limited income, which you can actually fix by becoming a medical lab technologist. And this specific Centennial course is very competitive because a lot of hospitals only hire Centennial students. And that was it, guys. I hope you enjoyed my presentation. If you have any questions, you can ask me.